Hi friends, in today's video we're going to talk about gallbladder stones. If you like this video, make sure to give it a thumbs up and subscribe below, and make sure to check out down below. I have a lot of free resources for you guys, as well as an NCLEX study guide and different pharmacology study guides and things like that. But let's get into this. So, gallbladder stones. So what are these? They are stones or calculi in the gallbladder that result from changes in bile components. 1 out of 10 patients with gallstones develop them in the common bile duct, and gallstones are made of cholesterol, calcium, bilirubinate, or a mixture of both. So the pathophysiology of gallstones is that first there's too much cholesterol. This can be due to age, obesity, or estrogen imbalance, and it causes the liver to secrete bile that is abnormally high in cholesterol and lacking the proper concentrations of bile salt. Then inside the gallbladder, when the gallbladder concentrates this bile, inflammation may occur. Excessive water and bile salts are reabsorbed, making the bile less soluble, and cholesterol, calcium, and bilirubin precipitates into gallstones. Then cholecystokinin fat enters the duodenum, causing the mucosa to secrete the hormone cholecystokinin, which stimulates the bladder to contract and empty. This leads to an obstruction, so the stone lodges in the cystic duct, the gallbladder contracts but does not empty, and the bile flow into the duodenum becomes obstructed. This leads to irritation and inflammation. Biliary narrowing and swelling of the tissue around the stone causes irritation and inflammation of the bile duct, and inflammation can progress up the biliary tree and cause infection in any of the bile ducts. So what causes this? So pregnancy, a change in normal hormone levels during pregnancy increase, as well as hormonal contraceptives can alter the gallbladder activity, predisposing patients to stones, as well as diabetes. Sluggishness of the gallbladder occurs because of increased glucose levels in the blood, and cirrhosis of the liver leaves scars along the common bile duct, which could trap gallbladder stones within the duct. So clinical manifestations that we'll see as the nurse is acute abdominal pain. The attack begins with this pain in the upper right quadrant that may radiate to the back between the shoulders or to the front of the chest. The pain may be so severe that the patient seeks emergency medical care. Recurrent fat intolerance. The patient is unable to digest fats properly because of dysfunction in gallbladder activity. We may also see jaundice because the stone is obstructing the common bile duct. We may see clay-colored stools because the bile is being obstructed. So complications. Cholangitis is an infection of the bile duct commonly associated with gallbladder stones and may follow percutaneous transheptic chorlography or occlusion of endoscopic stents. We may see obstructive jaundice, so too much bilirubin is absorbed into the blood and may cause this obstructive jaundice. Pancreatitis, so the pancreas becomes affected as the gallstone obstructs the common bile duct. And secondary biliary cirrhosis because the obstruction leads to damage of the liver. So assessment and diagnostic findings. So we can do an abdominal CT scan, which may detect stones in the gallbladder. We can do what we talked about in the last slide, the percutaneous transheptic chorlography. It's done under fluoroscopic control, distinguishes between the gallbladder and bile duct disease and cancer of the pancreas in patients with jaundice. They can do an endoscopic retrograde chorleo-pancreatography or an ERCP. It visualizes the biliary tree after insertion of the endoscopy down the esophagus to the duodenum, cannulation of the common bile duct and the pancreatic duct, injection of contrast medium. They can also do a hepatic biliary aminodidactic acid scan, so an HIDA, and it detects obstruction of the cystic duct. Or they can do a magnetic resonance chloroangiopancreatography, and this scan can detect gallstones in the biliary stricture and different masses. Abdominal x-ray. If gallbladder disease is suspected, an abdominal x-ray may be obtained to exclude other causes or symptoms. They can do an ultrasound. It's the diagnostic procedure of choice because it's rapid and accurate and can be used in patients with liver dysfunction or jaundice. And cholecystography is an oral cholecystography may be performed to detect gallstones and assess the ability of the gallbladder to fill, concentrate its contents, and contract and empty. A lot of tongue twisters there. So medical management, these patients will be put on a low-fat diet to prevent attacks. We will administer vitamin K to manage itching, jaundice, and bleeding tendency due to vitamin K deficiency. They may have an NG tube insertion during acute attacks, and they may need intravenous therapy during acute attacks. So different surgical management for these patients include a laparoscopic chlorocysectomy. Oh my gosh, I'm telling you. my mouth doesn't move like that. Visualization of the gallbladder is done to remove stones lodged in the common biliary duct. A chlorocysectomy with an operative chloroangiography removes the stones in the common bile duct, and it's one of the most frequently performed procedures. And an ERCP with spinectomy, and this procedure is the treatment of choice for obstructions or cholangitis, so an infection of those ducts due to obstruction. Nursing management. We will first assess by taking a history. We want to know a history of, has the patient smoked? Have they had respiratory problems? Are they currently having shallow respirations? Do they have a persistent or ineffective cough? Do they have any presence of adventitious breath sounds? We also want to do a nutritional assessment to evaluate dietary history. And we also want to look at laboratory results, so any previously obtained laboratory information. Our nursing diagnosis can include acute pain related to surgical incision, impaired gas exchange related to high abdominal surgical incision, impaired skin integrity related to altered biliary drainage after surgical intervention, or imbalanced nutrition less than body's requirements related to inadequate secretion. And again, this is just some examples of what our nursing diagnoses could be. So nursing care, planning, and goals. So these again are just some examples: relief of pain, adequate ventilation, intact skin and improved biliary drainage, optimum nutrition intake, and absence of complications. So our different nursing interventions can include lung exercises. So before surgery, teach the patient to cough, deep breathe, and perform leg exercises that are necessary after surgery. Patient education, explain the procedure that will be performed before, during, and after surgery to help relieve patient's anxiety. Post-surgery monitoring. After surgery, we'll monitor vital signs of bleeding, infections, and atelectasis. We'll do incision site care, so evaluating the site for bleeding, any type of drainage. Drainage is common for the first 24 to 48 hours. We'll do T-tube care, so after a cholecystoscopy, a T-tube drain is placed in the duct and attached to the drain bag. So make sure that the drainage tube has no kinks and check that the connective tube from the T-tube is well secured to the patient and prevent dislodgement. We'll also want to drain the T-tubes. A normal amount will be 200 to 300 milliliters. We want to monitor I's and O's and we want to provide pain management, especially before activities that increase pain. So our evaluation will include relief of pain, adequate ventilation, intact skin, improved biliary drainage, optimum nutritional status, and absence of complications. And again, these are just some examples, so yours could be completely different based on your patient's reaction to the interventions. So discharge and home care guidelines include the nurse giving education related to medications, and we want to inform the patient and the family of different symptoms that they should be watching for as far as physical, such as jaundice, darkness of urine, pale colored stools, and itching over the body, signs of inflammation and infection, such as fever or pain. We want to teach them how to drain the tube management and also to report promptly any changes in the amount or characteristics of the drainage. And we want to provide follow-up appointments. So our documentation should include the client's response to the pain and what they discuss as an acceptable level of pain. We want to do vital signs, respiratory rate, characters of breath sounds, frequency, secretions. What do those secretions look like? Any presence of cyanosis. We want to look at any skin damage and document. We want to document caloric intake, any individual or cultural and religious restrictions, plan of care and teaching plan, client's response to the teaching plan and actions performed, and attainment of progress towards desired outcomes. And that is it for bile duct stones. If you guys like this video, make sure to give it a thumbs up and subscribe below and check out those resources as well. I'll see you next time. Bye.